Rotator cuff tears. Let me explain the anatomy of the shoulder quickly. The shoulder is a ball and socket joint. It is surrounded by a group of tendons which are coming from shoulder blade muscles. There's a big tendon at the front of the shoulder, at the top, and two at the back. They're all connected, and that's what we call it the rotator cuff. The rotator cuff is subject to wear and tear over age. Most commonly affected is the one at the top here, so supraspinatus tendon, which raises the arm against gravity. It can also happen that in trauma, in falls from height or falls forward, the rotator cuff sustains some damage. The symptoms of rotator cuff tear range from chronic pain up to inability to raise the arm against gravity. That's commonly night pain that is difficult to manage with pain medication or anti-inflammatories. And often patients notice that above shoulder activity, changing a light bulb or painting the ceiling is difficult due to lack of strength. When a rotator cuff is torn and the patient is reasonably young, let's say until 65 or 70 years of age, the concern is progression of rotator cuff tear. So as a surgeon, we like to see these cases rather early because in general we are able to repair the torn tendons and restore normal anatomy. How that works is that when the tear occurs here, usually with keyhole surgery, we are able to clean the mess up and repair the tendon back to the bone. That requires rehabilitation, where the shoulder remains in the sling for a number of weeks, usually 4 to 6, and then a sports rehabilitation where a physiotherapist works on increase of range of motion and ultimately strength. Rotator cuff repair is a standard procedure with a reliable outcome. It is a little bit dependent on the age of the patient because obviously the tendon tissue quality deteriorates with age, but even in a higher age group, we can achieve consistently, reliably and good results.